So far, we have looked at the differences between superiority and non-inferiority trials. We interpreted the endpoints of these studies, and we evaluated internal and external validity of superiority studies. Now, given a non-inferiority clinical trial, evaluate its internal validity, which is the course learning outcome number 5 on the course syllabus.
So when it comes to internal validity, basically you will ask the same questions as you would when you evaluate the internal validity of superiority studies. So the first 9 questions are actually the same 9 questions that you would ask and evaluate for a superiority studies. Now, something that's specific to non-inferiority studies is, were patients analyzed in the groups to which they were randomized. So when it comes to non-inferiority studies, it's actually extremely important to have both per protocol analysis and intention to treat analysis. As I had mentioned previously, that generally in superiority studies, you really want to have an intention to treat analysis, and there are some exceptions. Like for example, if you were looking for toxicity of a drug, you really want to have per protocol analysis. However, when it comes to non-inferiority studies, if you get both per protocol and intention to treat analysis, and both are in agreement, they actually make a stronger case for non-inferiority. So, not to say that, if they only included one, you cannot claim non-inferiority, but when you do journal clubs on non-inferiority, you should, look for both per protocol and intention to treat. And if they only chose one of the two analyses, then you should, that should be your criticism, that they should have done both analyses. And then the other question that you should ask is, did the investigators guard against an unwarranted conclusion for non-inferiority? So because we're looking at how much worse your intervention can do, you really want your control group to receive the best treatment. So if the control group uh, receives suboptimal treatment, then it becomes easier to achieve non-inferiority. So suboptimal, it could be whether the patients are not adherent, or based on enrollment, you can have patients that are less likely to have the outcomes. So that's really important to assess in non-inferiority studies. The other thing that's important is to actually compare the event rates in the control group compared to studies that have been done in the past. So if the number of events is actually less in the new study, it's a lot easier to achieve non-inferiority, and you should question whether this is due to differences in patient populations, or there was something specific about the study leading to less events in the control group, which makes the intervention group be easier to show non-inferiority to the control group.